So there's a lot of different reasons to get an echo. A lot of heart related, obviously, like rhythm issues or chest pains. But there's also other things like stroke that we can do echoes on, shortness of breath, syncope, pretty much a lot of reasons that you could, get an echo, not just heart related. So I'm an echo tech or echocardiac tech. I do ultrasounds of the heart, kind of like a baby ultrasound, but we look at the heart instead. To begin with, you go in and you talk to the patient, you tell them what you're doing, introduce yourself, kind of tell them what the exam entails. Then we start in the middle of the chest taking pictures. We usually take about 80 to 100 pictures, so it's a pretty long exam. But we take pictures in the middle of their chest, under their left breast or on their left side, on their belly and under their chin. Really in school, I just really liked the science side of things. And so I, gravitated more towards anatomy type stuff more than the other sciences. To begin with, I wanted to be kind of more into the baby side of ultrasound, but it was a longer wait for the program. So I kind of switched over to echo to look more at the heart. And it actually is something that I'm really interested in now. I went to Atrium community college to begin with to do my prerequisite classes until I was accepted into the program, which was a 1-year wait. It kind of depends on how long or how many people are on the list. And then I went to Caldwell Community College for 2 years after that for the actual program itself. And during that, you do a lot of clinical stuff with different hospitals and offices. So that way you're kind of prepared to go into actual work after. I think definitely just being with the patients. It's cool to get to see different patients and get to understand their, reasoning for being in the hospital and just kind of being a comfort for them. Definitely just try to look up your prerequisites and things beforehand, because that can kind of set you back a little bit. But if you're able to get those things, beforehand, that gets you onto the list a lot quicker. When you're going into the process of getting into the echo school, you're able to actually go and be with a sonographer for a day to kind of see if that's something that you really want to do. So that's a good process, I think, before you get into the school, to just kind of see if that's something that is interesting to you. And it's just really a rewarding career just to be able to really dive into the heart. And it's crazy how much a specific organ can really affect the whole body.